Hello and welcome to the Digestive System 1. In this podcast, we'll talk about the mouth. So if you look at the cartoon, I've drawn a blue rectangle around the parts of the mouth or the oral cavity. So take a look at that. You can see I've got the oral cavity, the palatine tonsil, the tongue, the oropharynx, the lingual tonsil, and the epiglottis and the uvula as part of the mouth or the oral cavity. So when you take food into your mouth, that's called ingestion. And in the mouth itself, there's some minor absorption. So if you listen to the previous podcast, you know that most absorbance of things that you ingest, most absorption takes place in the small intestine. But you can get some minor absorption of things like nitroglycerin. The mouth includes the oral cavity. That's the cavity, so it's a space, and the oropharynx. So that's part of the pharynx, and the pharynx is commonly called the throat. The histology of the oral cavity and the oropharynx is a non-keratinized stratified squamous epithelium. So if you listen to the previous podcasts on histology of the digestive tract, you'd see that at the beginning of the digestive tract is stratified squamous, and the end of the tract is also stratified squamous. In the oral cavity and oropharynx, you have skeletal muscle. So that's the central nervous system yields voluntary control of that skeletal muscle. So obviously you have control of what you ingest, or aka what you put in your mouth. Your teeth and tongue work together to do mechanical digestion of the food that you eat. When you mechanically digest foodstuffs in your mouth, that's called mastication. Once the molecules in your mouth have been mechanically digested, and some are partially chemically digested, but once you get the food stuff to under some type of digestion control, then you can actually start to taste what you've eaten. Inside the mouth, you have the tonsils, and those have an immune system function. So in the tonsils, you have if you remember from the immune system, you have the immune system lectures. You have the B cells and T cells and macrophages. When you ingest a food and you've mechanically and partially chemically digested it, then you begin the process of swallowing, also called deglutition. So there is a deglutition center in your medulla oblongata that helps you coordinate the propulsive action, or the forward movement action of that food stuff that you ate, propulsing it towards the esophagus. So once you ingest the food stuff and you mechanically and partially chemically digest it, that is called a bolus, and that bolus moves out of the oral cavity past the uvula, which is just the terminal or the distal end of the soft palate. And then when you swallow, of course, the epiglottis will move downward to cover the entrance to the trachea, so that the food or the bolus will go to the esophagus and not into the trachea. That's the last voluntary event. So in other words, it's the last event that you use your skeletal muscles for. And then once you begin the process of swallowing consciously, then the smooth muscle cells throughout the GI tract take over to help propulse the bolus through the esophagus to the stomach, and then the small intestine and the large intestine. So the salivary glands, of course, secrete saliva into the mouth, or the oral cavity, and this is a cartoon of what a gland would look like. And if you cut a gland in section, you'd see that the gland contains both mucus cells and serous cells. So mucus cells secrete the thick Mucus and serous cells secrete a more watery fluid. But whether you're a mucus cell or a serous cell of a salivary gland, you secrete your product into a salivary duct, and then that salivary duct opens up into the oral cavity. The salivary glands are under parasympathetic nervous system control, so pressure receptors and chemoreceptors in the oral cavity will send signals to the parasympathetic nervous system that will send signals back out for secretion from the salivary glands to begin. There's a salivatory nuclei or a salivatory center in the pons and the medulla. Autonomic nervous system is the ANS input. Includes both parasympathetic and sympathetic nervous system. This is cranial nerve 7. If you remember from 201, that's the facial nerve. Cranial nerve 9 is the glossopharyngeal nerve. They participate in salivary gland stimulation. So you have low called tonic levels of autonomic nervous system input, so your mouth doesn't get dry, so you have a basal level of secretion. Also, the sight or smell or thought of food will lead to an increase in autonomic nervous system input to increase the output of saliva. Also, if you have acids or toxins in your stomach, you'll start to salivate. And everybody's probably done this right before you vomit. You'll start to salivate, and you usually are vomiting because there are toxins in your stomach. The mucus cells, like I said, secrete mucus. They're under sympathetic control, and then the serous cells that secrete a serous fluid, a watery fluid, that's under parasympathetic nervous system control. And you've probably all experienced when you're nervous, you're in a sympathetic nervous system situation, your saliva is thicker, has more mucus, versus when you're relaxed and you're resting and digesting, your parasympathetic nervous system tells the serous cells to secrete their watery saliva. So you make about 1 to 2 liters of secretion a day, and mostly they're water. Mostly the salivary secretions are water, but they have some ions like sodium, potassium, chloride, magnesium. They have bicarb in secretions from the saliva. There's also salivary amylase and lingual lipase. So salivary amylase is a enzyme that begins the chemical breakdown of carbohydrates, and lingual lipase is secreted into the oral cavity, but it doesn't actually start working. That enzyme doesn't start working until it hits the more acidic pH of the stomach. There's also in the secretion is nerve growth factors. So when you cut yourself and you want to suck on your wound, you are actually secreting nerve growth factor into that area. There's waste in your saliva, so urea and uric acid. Also, there's a pain reliever called opioorphin in your saliva. Again, that's there's a natural reaction to when you cut yourself to suck on the wound. So you're getting nerve growth factor and a natural pain reliever. Mucus from the mucus cells of the salivary glands helps to bind the food together and also lubricate the food for its passage into the esophagus. There's also lysozyme, which is an enzyme that can destroy bacteria. H2O2, hydrogen peroxide that can destroy bacteria. Also, there's a molecule called secretory IgA, which is an antibody that also can help to inhibit pathogen entry into the cells. The pH of the oral cavity, the secretions in the oral cavity is about 6.8 to 7. And then all over the mouth, there are intrinsic glands, so smaller glands that secrete saliva into your oral cavity, whether you have food in your mouth or not. The extrinsic glands are the parotid glands, sublingual and submandibular glands. And if anyone's seen anyone with the mumps, their face gets very puffy because the parotid glands are up near the cheeks. So continuing with the digestive system, we'll talk about the teeth now. So in this cartoon you can see on the right hand side there's a crown, a neck, and a root. So the neck is just kind of that part of the tooth that where the gingiva meet the tooth, so the enamel of the tooth. The crown of the tooth is above the gingival line, and the root of the tooth is below the gingival line. And then, of course, the outermost layer of the tooth is enamel. And then if you go deeper, you come into an organic material called dentin, and then you go into a pulp cavity. You can see in the pulp cavity that there are yellow, red, and blue strings. Of course, red is those are arteries or arterioles, and the blue are veins or venules, and the yellow are nerves. There's an alveolar bone so the alveolus is that space that holds the tooth. There's a periodontal ligament that holds the tooth into the alveolar bone, and then there's a chemical called cementum that helps hold the tooth in the alveolar bone. And if you remember from 201, that type of joint, the periodontal ligament, that type of joint was called a gomphosis. The dentin, back to the dentin, that's a living connective tissue. So the dentin can regenerate, but the enamel can't. And then this is just a cartoon of the teeth and the age that the teeth erupt. So on the left side it shows the age at eruption. So for instance, at age 7 or 8, your central incisors will erupt. At year 8 through 9, your lateral incisors will erupt. And then you can just kind of read through the rest of the teeth. And then on the right hand side are the deciduous teeth. So those are the ones. So deciduous is like from a deciduous forest, and those are the baby teeth. And that's it.